Good afternoon and welcome to United TV. This is our Bariatric Friday. Today is November 22nd, 2024. In this channel, we explore different things for our patients who are going through the bariatric surgery, or they may be going through weight loss and trying to live their healthiest life. Holiday season is coming up, as next week being the Thanksgiving, and we know that this is going to be a challenging time for our patients. And from navigating family gatherings and festive meals and managing stress and temptation, the holiday can feel overwhelming. You may be someone who can find yourself in your office with a cookie already put in at your desk, and then you are kind of fighting whether or not you should be eating. That can happen to a patient who's going through the bariatric surgery. Today, we are going to dive into strategies for navigating the holidays as a bariatric patient who's actually going to help me for today, of course, none other than Dr. Isaias Irgau, one of the best bariatric surgeons in the country, expert who really understands what our patients are going through. And that's what we are here today. Dr. Irgau, how are you doing?
I'm doing great, Kemal, and thank you. It's always wonderful to be here on our Bariatric Friday to discuss yet another important topic for our patients.
It's always fun when we have the right company. So, Dr. Irgau, I know we are going through the holidays, and between Thanksgiving and Christmas and the New Year, there are several business events, there are several family events, and patients are struggling. And even it's not a bariatric patient who are going through the surgery. These times can be very challenging for people at every different level, so that we can actually gain 10 to 15 pounds, right? So our goal is to make sure that we are not sabotaging the process for our patients. So that's why we have you for today. So what should we be avoiding? How we should be prepping for these? What can you tell us?
Absolutely. This is a very important and timely topic, right? Holiday season is about to start. It stretches all the way from Thanksgiving until Christmas, and very often a little bit beyond it as well. It should be a time of celebration, right? Of happiness, of gathering with family, friends, right? But if you're struggling with weight, it could be a time in which it could be stressful as well, right? Because as you mentioned, it is very easy to pick up a few or even several pounds if one is not careful. It is a long period of time with different events going on. And although obviously you're getting together with friends and family, the central event very often is food, right? And we do want our patients to enjoy this time. It should be a time of celebration and enjoyment, right? But if it's done right, then the other consequences, the weight gain and the stress also can be avoided, right? So I think one of the key things to stress is being aware of it and also plan for it. That is very important. So if you're caught really without any planning, it is very easy to really fall for many of the temptations around the food that, will be invariably there, events after event. And then, of course, feel very guilty, feel very unhappy, and add more stress as well. So being aware and planning, I believe, is very key. And the second important overall thing I want to mention also is patients need to be realistic. Holiday is not the time in which you want to lose more weight, right? You are losing weight in other times, but when it's the holiday, your realistic plan should be not to gain weight. That's the way to do it, right? This is the mindset one should go about. And then obviously you'll be able to enjoy the company of your family and friends, and also enjoy the food as well if it's done right and with the appropriate planning.
I think the emphasis on the enjoyment, right? So are we sometimes maybe exaggerating what that means? Like, why do we have to eat so much to get certain satisfaction? It's kind of like the thing that we discussed in the past, where you need to kind of have this relationship with food in a different way. And when I say this, I'm not saying that I'm doing everything right. So probably I'm going to have McDonald's after this session. It's a horrible thing to say. But I also didn't eat for the last, not calculating, but because I don't have enough oxygen in my brain. So it's 3 p.m. 8, like we actually have our dinner meeting last night. So let's say we finish eating at 9. So 3 hours, 12, that's 15, 3 hours, 18. So by the time we are done, it's going to be 19. So in order to do that, and I'm not going to have dinner tonight because I'm going to be on the road.
Right.
So I actually thought about it before I decided what I was going to eat. So I'm like, okay, I did this, and I'm not going to have that, so then I can have. And then I woke this morning. Now today's a good day, so not every day is like today. Like yesterday, I wasn't able to. And it was cold today. It's kind of like maybe snowing, maybe not. But so we have all the reasons to do it and not to do it. But if this is true for all of us, I just want to make sure that that's kind of like we are we set the tone for that for our patients. So this is not just you go through this or I go through this, but this is redefining the relationship with the food, because food, you have to enjoy it. Like, how much? Do we really have to put too much on that? And now with the holidays, we have to even put more emphasis on that. Can we not enjoy each other's company with too much food? Like, that's kind of like redefining that relationship is
So
something that I want to kind of like highlight.
So that's key. But that is more of a societal problem, right?
We're here to fix it.
Yeah.
Because
Well,
presidents are not doing
your
their
previous
job.
session, you did you did confront some formidable issues, and you had very, very good answers. But clearly, there is a societal problem, right? I mean, we are all wired to seek food. That is really part of our DNA, right? Because to survive, we have to eat. It's part of energy need for us, right? And for the longest part in our evolution as humans, the biggest threat to our survival was lack of food, right? We didn't have it. Food was very difficult to get for the longest period in our history. It's only this very, very recent generation of humans that has been able to really not only be able to plan, with agriculture and other methods, but also after the Industrial Revolution and certainly in modern day America, you don't have to go anywhere. I mean, you can sit in your room at midnight and food will come to you. You just with a few clicks, right? So we don't have that problem anymore. And yet the wiring that was with us to compel us to search for food is still here. And that's the biggest problem they're having, obviously, right? So you are absolutely right. We shouldn't be looking for food to just be to enjoy ourselves. And yet, because of that wiring, we are unable to see that. At least the vast majority of us don't see that, right? That hurts particularly also our patients who really struggle even more than most people with weight gain, right? And we have to protect them. And then all this emphasis we're putting on on education of our patients is really to arm them with methods that will allow them to overcome all these challenges. And holiday season is going to be very challenging, right? You go to any holiday event and you will see an abundance of food. In fact, people will never go to a holiday party unless there is a lot of food, right? I mean, if we do our holiday party, for instance, come out for our practices, and we decide not to have food, guess what? Next year, no one is going to show up. Right?
Not just food, but good food.
Good food, exactly. So I think it is there. So what do our patients have to do? They have to plan, just like you were saying, you plan this day so that you wouldn't have to struggle, right? Planning is very important. And then the other main thing you mentioned is not to eat too much, right? That's key. How do you avoid that? Well, you have to be very conscious of portions, right? For instance, one of the strategies that I would say is very important for people, for our patients to do when they go to a holiday party is not to go there hungry. That's critical, right?
Right.
Make sure you have something, some protein, that you've eaten something before. So when you go there, you're not famished. There's no worse thing than a combination of being famished and then a lot of food in front of you. Then you're not going to be able to control yourself.
And one of the things that I do for that is like the boiled eggs and egg whites.
You always talk about that. Absolutely.
And that actually, I can, all of our work parties, I have done that at least 3 egg whites, and it works. I mean, as I remember you complaining about a couple of times where why I don't eat at those events is because I prepped. As you said, like it's extremely important to not to go to those places, just like not go shopping when you are really hungry. So because you kind of lose the focus and then you buy all these different things that you shouldn't be buying. Now the prep can come in different ways, but I think one of the difficulties with these holiday times is friends and families and having this with the understanding of everyone is trying to do this all together. So it's not easy to get everyone agree on what you are trying to do. So that's one of the things that people are, struggling. Like I'm going to be in Turkey for 2 weeks, and then one of the things that I have to overcome is my mom and her insisting on how much I should be eating and why I didn't eat, why I'm playing with my food. I'm 50 years old, so she tells me I'm playing with food. So and that becomes sometimes maybe your significant other, your other friends. So there's a lot of pressure. What do you say best way to kind of handle those types of pressure?
So use strategies again, right? As you correctly said, most people will not understand what the needs of a bariatric patient is, right? The fact that a bariatric patient needs to be disciplined, that they have a very small stomach, and that they have to be careful not only about what they eat, but definitely on how much they eat. So, and very often people will misunderstand your reluctance to eat as something not polite, right? Maybe you're being rude, or maybe you don't like them, or you don't like their cooking or their food, right? That's not it, right? But obviously, planning and having strategies is important. For instance, one strategy that would be good would be for the person to grab something in their hand, some food that they're going to eat very slowly, so people don't come and put food on that plate if it's empty, or if your hands are empty, they're going to hand you a plate and you will have to take it. But if you go proactively and you have a glass in one hand, a glass of water that is, and then you have a plate that has some food, then people are not likely to come and put some food there for you, right? But beyond that, also, come on, it is okay to say no at some point, right? It takes practice, right? Because it's not very easy to have to say that to people who are very close to you, but you have to learn to do that, because at the end of the day, you have to protect yourself and your health, essentially, right? There is no point in pleasing others and then do things that are harmful for you and for which you're going to be so upset and sorry in long term. You have to be first kind to yourself as well and understand that your needs are critically important. And you don't have to offend people to be able to do that. You just have to approach them with in the right manner, essentially. So all these are good strategies. Another strategy that is important, particularly in these gatherings where very often the food is in a buffet style, is to actually strategically position yourself away from where the food is, right? If you're standing right close to the food and conversation starts, guess what? People are going to be munching, and then automatically, almost like, by habit, you're going to also do the same, and there's going to be a lot of unconscious eating, which it can adapt to somebody who's had bariatric surgery, who's supposed to get full with really a few bites, and yet they can end up eating a lot over time. So staying away from that area by itself not only will be less tempting for you, but also it is less likely for others to invite you to join with them and to have more food. So having those strategies obviously are very, very important.
So I think the other issue is dealing with alcohol during these times with the so many different parties, and alcohol has so much unnecessary calories. What would be the best way to avoid or minimize?
So I would say the best policy would be to avoid alcohol, right? Now, how can you do that? Well, one easy strategy, for instance, would be to grab a cocktail glass, for instance, and instead of having the alcohol there, have something different in it, some water, sparkling water, or whatnot, that could look like it is alcohol, so people are not going to bother you for much drinking, right? And also hydrate yourself is very, very important, because if you do end up having a little bit of alcohol, the impact is not going to be as strong, right? So this is important, and as we've mentioned this in our session on alcohol consumption and bariatric surgery, it can be very damaging.
Right.
It's not only a question of, oh, you're going to be drunk that day, but you could actually become very, very sick, particularly if you're somebody who's had gastric bypass and you end up drinking too much. That could put your liver in really bad shape because of the reasons that we mentioned in other sessions. So I would say the best policy would be no alcohol, right? But if it's unavoidable, then you have to find ways of doing the least possible amount and hydrate yourself, because one of the things that happens with alcohol is obviously dehydration. You say that all the time, right? Well, it's very important to drink plenty of water so that you don't have to get into that situation. So my advice would be best not to if you can, but if you have to, then minimize it. And also try to avoid alcoholic drinks that have too many calories, right? For instance, the mixed drinks, Kemal, will have too much in terms of calorie because of the different sweeteners that are added.
They cannot have apple martinis.
Absolutely. So those are important things. But you're right. Alcohol is obviously very prominent in holiday parties, and the bariatric patient must be well aware about it, and then find ways of avoiding to be trapped in that situation.
And I think one of the other issues you mentioned earlier a little bit on the social situations, peer pressure, and what I see, what's happening with people is they're really bad communicators, and people don't understand what communication is. Communication is not just telling someone what you think is happening, but it's telling them in a timely manner. So if you're coming to this event, it's 3 p.m., right? So if you tell me at 2:58 you are not able to make it, but you knew that was at 2 p.m., well, you're a surgeon, anything can happen. Okay. So the 2:58 is not a communication. So 2 p.m. would be a communication. As soon as you find out about the issue, I'm just giving that as an example.
Yeah, of course. Of course.
But people don't really communicate these things with their friends and families in a way that they can understand. So maybe time the communication and heads up to those individuals who maybe, like, you should call my mom and then tell her, hey,
I can use Google Translator and communicate very well right now.
So, take it easy on him. And but the thing is, they should be able to tell, hey, this is not okay for me. It's not about just you trying to be nice or insisting on this and that. You have to kind of draw the line, and then they know that this is not okay, because that would be the last thing that I wanted to, who just had surgery 8 months ago, lost 80 pounds. Now I'm telling them, hey, you should have this dessert or you should have this cookie. Like, no, you shouldn't. And they should know that. I think like some communication probably would be helpful. What do you think?
Absolutely. I think it is. Clearly, there is, the relationship defines also the level of transparency that the patient wants to engage with, right? Mm-hmm. For instance, they may not feel comfortable letting others know that they've had bariatric surgery, and clearly this is very, very legitimate, right? It is something personal, it's something private. And if they do want to do that, then they have to find other ways for expressing, their desire. And as I say, sometimes saying no is important, right? Particularly when you think that that's the only way of dealing with it, right? Or you could let them know in general terms that for health reasons that you're not able to really go beyond a certain point. And once you say that, people will understand, whether it's, a recent health problem or something that you've had for a while, or recent consultation with your doctor, advice from your doctor, right? Of course, if you can be open about bariatric surgery with the people that you're surrounded, that's even better, right? Because not only you will be doing a favor to you so that you're out of the pressure, but also you'll be doing a favor to other bariatric patients, because that will be an opportunity for you to educate the people around you what it really means to have had bariatric surgery, what kind of limitations there are in terms of type of food that you are able to eat, but also how much food you're able to eat in any one setting. So I think I agree with you. Communication is critical, but that communication is going to be really tempered by the level of transparency you want to
Right.
adopt, essentially, with regards to your own health
But if they
situation.
had a heart
Yeah.
surgery, open heart surgery, and then you go somewhere, wouldn't they want to tell them, hey, I had open heart surgery, I shouldn't be doing X, Y, Z? They would, right? So that's why I think we need to take this out of this box and then say, look, this is what it is, this is what happened to me, and then you need to respect that. So
Absolutely. I mean, that would be clearly right. But again, so you do not want also that holiday situation to be a discussion about whether that's right or no, because people have their own preconceived ideas about what bariatric surgery is, right? And that person may not want to engage in that. That's obviously could be a limitation as well. Or it could be a situation where the relationship with those people is actually much more formal, right? They could, for instance, it could be a holiday party of a company where there are a lot of people from different departments coming in, where you really don't know them very well, right?
But they wouldn't insist on you eating something.
They would not, but the setting itself could put pressure on that person to do that, right? In which case, rather than explain, using the strategies that I was talking about would be useful, right? So stay with something in your hand all the time, so people are not going to insist. But the other thing we didn't mention also, Kemal, is the usefulness of eating very slowly, right?
Right.
So that will give you enough time in terms of really consuming a very small amount over a longer period of time, so you don't have to rush for more. But also that can only happen if you come prepared. For instance, if you come very hungry, it's going to be very difficult to eat slowly. The minute you're distracted, you're going to start overeating. But if you are prepared, right? If you're coming really with that fact that you've eaten something, so they're not going to be famished, then eating slowly is something you can do very, very easily, right? We were at an event, was it the night before last? There was the St. Francis Medical Staff meeting, and they were, before dinner, they were serving a lot of hors d'oeuvres. So people were being around. So if you have an hors d'oeuvre in your hand already, somebody will not come and, try to serve you that as well. So those strategies are important for people to be protected. And as I say, the other one would be to stay away from the food, and then obviously eating very, very slowly as well.
So what about those individuals who wasn't able to say no, and then they kind of indulge themselves and eat too much? How would they kind of deal with that after it happened?
Well, so sometimes they could actually get sick on the spot, right? So there, for instance, for people who had gastric bypass, they could have something called dumping syndrome if they're eating the things they shouldn't be eating, and that could make them very sick, and it could ruin their holiday party for them. They could have abdominal pain, they could have nausea, they could feel like throwing up, and they could be sweating, or even pass out, God forbid, right? So it is important to understand, particularly with procedures like where there has been intestinal bypass, like gastric bypass or the renal switch, they have to be very careful because those things can happen. For instance, a person who's had gastric bypass, if they were to eat refined sweets, they could have the damage, right? Or if it is somebody who has a gastric band, for instance, and they eat too much too quickly, they could feel they have to throw up for them to basically. Or even somebody who's had a gastric sleeve, Kemal, if they're eating really too quickly and they don't stop at the sensation of fullness, they could end up getting very sick as well. And of course, not to mention the fact that if it is somebody who's just had surgery a couple of weeks before, then that would be a definite problem for them. In fact, if they've had surgery, within 2, 3, even 4 weeks, I would say avoid those situations, Kemal, because the chance of getting sick are very high. You remember how we talk about the progression of diets early after surgery, where our patients have to be on a liquid diet for a couple of weeks and then a pureed diet for another 2 weeks. And that is because eating, chewable food or too much food can make them really, really sick, right? So if they were to show up at the holiday party, so early after surgery, obviously, unless they really have planned very well and they let everybody know that they've had surgery and they cannot have certain things, they could become very sick. So that is the immediate danger. But how about afterwards, right? Kemal, that you overeat, and then there is the guilt, right? You feel horrible, you didn't plan to do that, and now you're going to gain weight, what to do? So instead of enjoying that season, now you are actually, struggling and emotionally, and that's not healthy, and that's not very healthy. And not to mention the fact that it can really throw you into a bad cycle, essentially. So it's not an easy situation, really. We do not want our patients to get into that situation at a time of the year in which they should really be having fun and enjoying their families and friends' company.
So I think the overall we kind of touch almost every issue potentially, but there's also a group of patients who are getting ready to have bariatric surgery, and especially prior to the surgery, 2 to 4 weeks is extremely important because we want those livers to be smaller, right? So this is not about losing weight before surgery. It's about shrinking that liver.
You have a new name for that, right?
Right.
You want to call it liver shrinking diet, which I agree with you. Totally.
I did borrow this. I'm not gonna, I did borrow it from
That's
somewhere.
okay.
So,
No worries.
but I think it's a good way to emphasize the issue because many patients who are going through this, they think that we are putting them on some diet for them to lose weight. Well, partially true because we want them to lose weight, not because of the surgery itself, but for complications of what their liver can do to the surgery. So, and for those patients, this time is a bit more important. Can we actually just emphasize?
Absolutely. So I would say probably, in this kind of situation, it's probably best to avoid these events totally, right? Because particularly the patients who are on that special meal replacement diet, they are not allowed to eat anything else at all, right? So they don't want to be in a situation where they're going to be very tempted. They don't want to be in a situation where they have to explain, to others if they don't feel comfortable why they are not able to participate in the feasting with food, essentially. So I would say, particularly our patients, and it's a tough thing, right? Because there are clearly patients of ours that are getting ready to have surgery around Thanksgiving, around Christmas, and the timing could be something that they have chosen because of work situations and other things as well, right? But needless to say, their preparation will entail some degree of isolation from this type of events because otherwise they could end up hurting themselves. So my best advice would be, yes, you're invited to a Christmas party, to a holiday party, but it is just not going to work with you being in that particular diet. So the best policy would be to avoid these situations.
And this is an important time for them. So then missing one holiday party won't be the end of the day and end of the world. So, thank you for joining us today for this episode of Bariatric Friday. Our goal was to provide tips and insight to empower our patients and make their approach better for what's coming to their way. Dr. Erkan, thank you so much for joining us. Your guidance and your expertise is extremely helpful. It's giving the confidence to those patients who are actually listening to you. I hear this from our patients. We get a lot of good feedbacks. And our goal is to make sure that we are there for our patients. And we'll be back in 2 weeks with our new cycle of the Bariatric Friday. This was our last episode of this cycle. And we have done so much this year with this channel, and Bariatric Friday was a big part of this channel. And with almost more than 80,000 subscribers, we are strong. Our goal is to hit 100,000 by the end of the year. Hopefully we'll get to that point, and we'll see you in 2 weeks. Well, happy Thanksgiving and stay safe.
Thank you. Bye-bye.